Like this, Roscoe,
Okay.
Or animals were harmed in the production
Of this podcast.
This is a production of the WWDNYK Studios. No children or animals were harmed in the production
Of this podcast. Okay, everyone. So, hi, welcome to the WWDNYK Studios. We're doing our inaugural episode of Unbreaking Science with the video podcast. We've done boot camp podcasts of Unbreaking Science. There are 3 of them at unbreakingscience.com, where we go into great detail about what constitutes valid and invalid science and how we can improve the way that science is conducted. We're going to be going into an interview with Doug and Rishanne Golden in a little bit here, but first I want to thank Anu Vaeda for helping me set up the studio, and I want to thank all the donors who donate at the Patreon to help WWDNYK Studios get off the ground. I'm very fortunate to have the community support, and you can find me at jameslyonsweiler.com, and you can find my work at PubMed, my peer-reviewed work at PubMed. And of course, I'm also the CEO of the Institute for Pure and Applied Knowledge, where we conduct research in the public interest without profit motive. That's at ipa-knowledge.org. So today, because it's our first episode and I'm driving as well as interviewing, what I want to do is just kind of talk about the studio, how it's set up, and why it's set up this way. What we have is 2 cameras. We have a camera that's got me, and then we have another camera that's got Doug and Rishanne, who I'll introduce in a minute. And we're doing a dialogue. This is going to last about 2 hours. We started at about 1:45. It'll last about 2 hours, and we're going to talk about anything and everything, whatever occurs to us. Certainly, we're going to be talking about their daughter, but we're dealing with a situation where public health policy as a little bit disconnected from the science, and the result is having devastating effects on some individuals' lives, and I think we can do better. So, also, I'm a human being. Doug and Rishanne are human beings, and so we're going to talk with them about just about anything that happens to occur to us. So, with that, I'd like to introduce Doug and Rishanne Golden. Welcome.
Hey, thank you for having us.
Right on. Thank you. So, you came all the way from where in Ohio?
We come from Marysville, Ohio.
Marysville, that's right.
Which is just northwest of Columbus. And about 3.5 hours later, we arrived here at this fantastic studio.
All right, great. Thank you. The drive was fine, I take it?
Drive was great.
Weather cooperated?
Weather cooperated. Cruise control works wonders.
You guys listen to music when you travel?
Not today. Sometimes, but today we were just conversating. We've had such a crazy few years. It was an opportunity for us to finally catch up a little bit and see just chat and what was going on.
Very nice. Well, I strongly recommend some Boston on the way home.
Okay.
You guys want to hang out in Pittsburgh for a while afterwards? Grab some lunch or something?
We might. Yeah, we probably could do that.
Yeah,
absolutely.
That'd be good. I'd like that. So where do we begin? Tell me what you do. Let's find out about Doug and Rishanne first.
Okay, I'll jump in here. So Rishanne and I met 26 years ago. I'm going to go way back. I'm going to give you the whole story here. And we worked in the restaurant business together. And I was a general manager, and I came back from a vacation, and this young lady was in my kitchen training to become a manager. And I walked in and said, "Who's this lady?" And they gave me the whole backstory. And basically, we started dating, and she left because she couldn't work for me anymore. And went into a office manager position with a company we worked with that supplied printed apparel, promotional items, all that stuff that the company I work for bought from. And a couple years later, she said, "Oh, I can do this on my own." I had proposed at that point. We were going to get married, and Rishanne started working this business 25 years ago.
Yep, 25 years this year. Yep.
Out of her house where we lived in Maryland at the time, in between in a city called Laurel, which is right in between Baltimore and D.C. 22 miles to the front door of the White House and 22 miles to Camden Yards. Couldn't ask for more. It was perfect.
Right on.
And then, so we started doing that. So right now we own a business. And as I say to everybody, I work for Rishanne. She's the owner. She's the.
Oh, really?
That's
So that's kind of.
But I did it 2 years by myself, and then because at the time, a year in, I think I got pregnant with my first daughter, and I thought, I wanted a little bit of flexibility, but could we really make this work? And about another year in, I said, yeah, I think we could do this, make a go of it. And 26 years later, here we are.
And what's your business?
It's called Good as Gold Promotions. We do embroidery, screen printing, promotional items. We're a brand and apparel specialist.
So Good as Gold Promotions.
Yes.
Okay. So brand apparel and
promotional
products.
Items.
Okay.
Put a logo on it. Embroidery, screen print, window decals. We're gonna be doing some stuff for IPAC, so we'll make sure people get in there.
Coffee mugs, T-shirts,
all that.
sweatshirts. Cool.
Yes.
So if we can start with when Haleigh was first born. We're here to talk about Haleigh, and we're talking about vaccination. We're talking about what happened with Haleigh with vaccination. When she was first born, well, first of all, they didn't vaccinate during pregnancy back then, right?
I don't recall, but I don't believe so. I don't remember. No, I do not remember being vaccinated.
Okay. So when she was first born, did she show any signs of vaccine adverse events at all?
When she was first born, she was a heavy sleeper, and she was sick quite often. She had allergies and eczema.
You speak up a little.
She had allergies and eczema.
Yeah.
She had asthma early on, was diagnosed with asthma, was put on a nebulizer, was given steroids, albuterol.
At what age? About?
This is all between probably 2 and 4.
So
she had eczema though very young, because I remember her skin.
Yeah. So they give nebulizers to 2-year-olds. Okay.
We had a machine. We called it the breathing machine. You know, we did everything that we could at that age to not have her be afraid of it.
Yeah.
So, you know, we actively treated it like it was a friend to help her have better breath.
The cat was on. There's cat hair all over the place. Sorry, everybody. Roscoe's joining the. She's. Oh, okay. Yeah, all the cat hair is blowing up into your face. So autoimmunity was apparent in her early days with eczema and asthma. These are autoimmune conditions. What about your family? Do you have any evidence of autoimmunity in your family?
We did not until about 3 years ago. We didn't realize, you know, we believe whatever our doctors told us. So I didn't even know what the word autoimmune meant until about 3 years ago. And even then it was foreign until about the last year. Then I really understood what it meant.
Okay. I wanted you to pull the mic a little bit closer to you guys, if you could. Yeah, that's good. See you, Roscoe.
Bye, Roscoe. We've had enough.
So there is, like, how many people in your family have evidence of autoimmunity?
I know that I do have autoimmune, as does our older daughter. And if I were to guess, I don't have proof of it, but I think there might be other family members in my family that do. I'm not sure about.
couldn't. I've never asked. I mean, I had eczema on my arm for a while, but it's cleared up.
Okay.
So I don't know if that was anything or not.
All right. So what was Haleigh like as a 4 or 5-year-old? What was she like as a?
She was always a whippersnapper. Yeah, she was just. It was almost like 2 children, because it depended on who she was with. If she was with her older sister, then Taylor would just make her laugh,
Yeah.
and she just kind of hung in the background. But when she was by herself, I mean, she was her own person. She loved to play at the playground. She loved to climb trees. She loved to play in the gravel. She was just, I guess, I don't like the label, but tomboyish, you
Mm-hmm.
know. But then she loved frilly things too. I remember her being around first grade, and she wanted to take dance lessons. And I remember her putting on this beautiful peach little ballet costume for her recital, and
Yeah.
she just would, go around the room saying how pretty she was. And so Haley knew who she was, and she was she was stubborn, she was pig-headed, but she was very kind and generous.
Yeah.
Um,
Did she have any health issues age 4 or 5?
she was always sick. I remember her preschool graduation, and I was looking at a picture recently of her, and she had a fever, a low-grade fever that day, and her eyes were all watery, and she had bags.
Mm-hmm.
And we didn't understand that then. We just thought, she was sick.
Yeah. So when you say you didn't understand that, for people who don't know anything about what you're talking about, what was there to understand about bags under the eyes at that age?
Well,
What were you
first of all,
thinking?
to be told that, kids outgrow it, I remember hearing all the time, she'll outgrow her asthma. I mean, and
Yeah,
as
she
you,
stopped vaccinating,
exactly,
right?
absolutely.
So,
So this is anything that I say is always through layman's eyes. I don't claim to be a doctor or anything close to that. So what I've learned, I had no clue, was never told that vaccines contain neurotoxins. They contain aluminum. They contain formaldehyde, thimerosal, depending on which vaccine. They contain aborted fetal cells and animal cells and live viruses and
yeah,
MSG and so on. And so when you understand what those do to the body, I mean, you're injecting these things into children where their immune systems aren't even developed, and they're creating an immune response.
can I ask you, did she regularly get the flu shot as well?
Not to my knowledge.
Yeah,
I don't think we
I
ever
don't think
gave her
anybody in
that.
the family.
No, I would say is that whatever the pediatrician said was the standard point of care for well checks, that's what we did. And so without pulling her records, I wouldn't know. But for somebody born in 1998, whatever the pediatrician said to do, we didn't question. And we said, okay, that's what it's time to do. And you hated going in there and having your daughter injected and have them cry and feel bad. And,
Yeah.
but there was no one that we knew who didn't do that. So
Right,
why
right,
would
right.
we ever think to question?
What's your favorite 4 or 5-year-old, 6-year-old Haley story?
Do you have one?
I know you. I would have to think about it for a
What's
few
your
minutes.
favorite all-time Haley story? Just
My favorite all time is as she was older now. Actually, it's only been a few years. She loved making noises at the table.
That's what I was going to say.
Okay, she would sit at the dinner table. So as a family, one thing we always made sure was every night when we could, we would all sit at the table, all 4 of us, and we would have dinner. No cell phones, no
Even
nothing.
if we could stop work
Yeah.
early to have dinner before soccer,
Yeah.
even if it was a light dinner, a meal together.
And if we got into a topic of conversation for whatever reason it was, and she did not want to sit down and have that conversation, she would go ahead and make these sounds like she was like Chewbacca from Star Wars. She would lean her head back. She would start making all these moaning noises, groveling or whatever else. And the funny part was, she could only do it when she was in the mood. She could not perform that on command.
Yeah, that's what she would say.
She would always say, "Hey," we would say, "Hey, make that funny noise," because we needed to lighten up the mood. And she would go like, "I can't perform on command."
Yeah.
So that's my favorite story. It's probably yours too, I would
Yeah,
think.
because she was so witty. I mean, some of the things that would come out of her mouth, even my mother-in-law would say, "Where does she get that?"
Yeah. Did she have any favorite practical jokes that she pulled on you guys?
Yes, both of my girls. So, because one of the practices that I had, one of the things that I envisioned for my life when I thought about creating our business was to have the flexibility of still kind of being an at-home mom, because I worked from home, so I could kind of tailor my schedule to still suit some of the needs that I thought important, like being able to sit and talk with my kids when they got home from school.
Yeah.
So in my office is a chair, and when they would come in from school, they would sit down in the chair. Well, my girls were 3 years apart, so when Taylor went off to college, Haleigh had 3 years of me all to herself, and so she could really just share. And sometimes we would just, as she would say, shoot the shit, if you can say that, for like an hour and a half or whatever, you know. And I don't know where I was gonna go with
You were
this.
going with practical jokes.
Practical jokes.
Yeah. So my kids would. I remember one time in my frame in my office, I had a picture of two slots, one for each girl. And so one day, I don't even know if Haleigh was at college or when this happened, but I'm like talking on the phone. I think I might have my legs crossed up or whatever, and I look over. I'm like, and I go over to the picture, and it's a picture of Tom Hanks. They had printed it off and switched out the picture, so they had.
Did she think you liked Tom Hanks or
No,
something?
I think she just wanted to be like, I don't like that picture of me, because she did not like her. She did not like herself photographed.
She hated photos.
Yeah,
I see.
she didn't love herself photographed at all. That's why she probably.
She was a beautiful girl. She was a beautiful girl.
So
So I'll share back with you one of my sons, my favorite all-time Ben stories was there was a girl. Her name was Brittany. I won't say the last name. He was in kindergarten. It was like the early stages of kindergarten, first days. And this girl, Brittany, I said, "How's school going? Is everybody friendly to you?" "Oh no, there's this one girl, Brittany, and she's so mean to me, Dad. She doesn't like me. She's mean to me." And Ben's totally likable 5-year-old kid, going to kindergarten, very friendly. His face is symmetrical and everything. No reason to pick on him or anything that kids would do. And I said, "Well, Ben, I'm going to tell you some secrets about boys and girls, and I'm going to give you a secret about how to know when a girl kind of likes you, like likes you." He goes, "Oh yeah, how do you know that?" I said, "Well, they're really, really mean to you when they like you. They're just mean to you. And you know how if they really, truly like you?" He goes, "No, how?" I said, "They kick you in the shin." Right? About 2 days later, I'm at home sitting waiting for my son to get off the bus at the bottom of the driveway, and he gets off the bus and he comes running down the driveway. He says, "She likes me. She likes me." She had kicked him in the shins. So I don't know why I nailed that one, but our kids are more than extensions of ourselves. You'll agree with that, right?
Yes.
Yeah, our children are the best parts of ourselves, and any parent out there can certainly understand the bond that you had and have, I'm sure, with Haleigh and her sister. So when we're looking at 11 or 12-year-old, standard things going on with girls, life changes and so on, talking with her about, okay, this is what's happening to you, honey, with respect to puberty and so on. Was there anything that pops out at you where she seemed to have differences in her health or her development compared to other kids?
Yes, for me, I always think back to Haleigh was an athlete. She played soccer for 6 or 7 years. She danced twice a week. She was in show choir twice a week. So she was an active child. And I know that she had a DTaP vaccine, and I didn't know it at the time. Like I said, back then it was completely ignorant to recognizing any red flags, any symptoms. But for both of my girls, I noticed around, because they get their first meningitis shot around 7th, 8th grade, and I noticed, even though Taylor did not play sports, but she danced the same 4 nights a week. Both of my kids around 10th grade, ninth or 10th, started gaining weight.
Mm-hmm.
And nothing in our family had changed. Our eating hadn't changed. Their activity, they were going, they were good students. They were active. They were out of the house 4 nights a week and on the weekends with friends sometimes. Nothing had changed. Didn't realize that now we look back and, their bodies were struggling to detox. Their livers were struggling, their thyroids.
And the weight gain that you that you noticed, was that temporary? Did they have to work on it? Was it
It just
what did the
kept,
doctor say about it?
well, her pediatrician never really commented, just, oh, exercise more. And I thought, I just kind of dismissed it. Like, okay, well, maybe this is their physical makeup. You kind of just put it to the backside. You don't really question it. You try to maybe eat a little bit better, but drink more water. But neither one of my kids drank soda. It wasn't like they were filling up on sugar. And we weren't Starbucks families because, we don't, we're coffee families, I guess I should
Yeah,
say.
we're plain coffee,
Yeah.
not Philly coffee.
Yeah, coffee is what drives all the science forward at IPAC.
Yeah.
I'm a machine that turns coffee into scientific publications. So.
There you go.
But yeah, so in terms of health choices, you mentioned the diet and so on. You ate a typical American diet or an exceptionally healthy diet?
No, it wasn't exceptionally healthy, but we did make sure we had a healthy dinner. And both of my kids had breakfast every morning. Unfortunately, looking back, they had, Cheerios, but they had Cheerios for breakfast. And, lunch was usually a sandwich and a piece of fruit.
Hmm.
Dinner was
Yeah,
was always a healthy dinner most of the time.
We always had a vegetable with a meal. We always had
Vegetable, fruit, and protein.
We were not big on junk food in the house in general. Very limited. We didn't have a lot of candy in the house ever. Nobody drank soda. Nobody drinks the sugary drinks.
Yeah, so you're a healthy family, and vaccinating, you're also trying to protect your kids from infectious diseases. So, I have a funny story about Cheerios. You mentioned Cheerios with the revelation that glyphosate, can cause cancer, or so should be labeled as suspected carcinogen, and the revelation that the science that showed that glyphosate could have been, it was likely a mutagen, and carcinogen was hidden by scientists that were contracted by Monsanto at the time, to make that determination. They actually had one scientist. It came out in the trial. There was one scientist that said, "Listen, this is what the literature says." Doing what I do, I go to the literature and I say, "This is what the literature says." And there's internal documents that show, oh, okay, can we find some other scientists that might not put such a heavy emphasis on this and give a different interpretation? So, everyone should be glyphosate risk aware. Obviously, on Twitter, I saw a Cheerios tweet from Cheerios, right? I love Cheerios. And I'm like, okay, well, when you decide to get glyphosate out of your product, that's when I'll start. I spoke for the community. That's when we will start, buying and consuming Cheerios again. And I actually got a reply from Cheerios.
Oh,
which,
wow. Interesting.
Yeah, that was kind of weird that they actually, whoever runs that account for them, decided to reply to their tweet, and they said that their product is extensively safety tested. All the chemicals that are there, are there in low amounts, and they're extensively tested for safety. It sounds familiar, right? They're extensively tested. When we know, we have in our hand, we know the knowledge about the status of the extent of the corporate leadership's role in trying to hide the actual science. So that's a little by discussion about that. So Haleigh was on the CDC schedule per recommendation, other than flu vaccine, right?
Correct.
And so, did any of the other vaccines give her any problems?
I mean, looking back, I believe they all did. I think, when we speak with her functional neurologist, he describes it as such. He will say that everyone has a glass, and the glass continues to fill, and as we fill it, the body is the glass, and the body can only handle so much, and when the body can't handle so more than it can hold, it spills over.
Talk about toxins.
Yeah, it spills over. And
functional neurologist, that was her functional neurologist.
Yes.
Why did you guys have a functional neurologist? Is this after the Menactra, or?
Yes.
Hello.
So the only reason that we were able to locate a functional neurologist completely outside of our vocabulary understanding, we didn't even know such exists, was because a couple years prior to Haleigh experiencing seizures, I had my own health crisis. And after 18 months in Western medicine and having no one be able to help me or understand what was wrong with my body. Desperate that I was going to die and not see Haleigh graduate high school, we located a functional doctor who I credit to saving my life. And within 6 weeks of functional tests, we knew exactly what was wrong with me. And I started a protocol which included whole, organic, clean food and included quality supplements and no pharmaceuticals. And in my experience in 18 months with Western doctors, everything was, we don't know, and here's a pill, try this.
So that's called, let me talk about that for a minute. So when you go to your doctor and you have a set of symptoms and they don't know what it is, and they treat you with a drug first, and they say, well, it could be this, let me treat you with it. If you get better, then I'll know what it was. That's called diagnosis by treatment. And it's one of the most unethical ways to approach a patient, in my estimation, if you're a medical professional, because basically you're conducting an experiment on that person to try to test the efficacy of a drug to see if the efficacy of the drug proves that they had a condition. But in actuality, it doesn't prove anything, because many times people have conditions that go away on their own. The body heals itself. And yet what it is it's a setup where, okay, I give you this drug, you didn't really see any benefit. Might be this other thing, so I'm going to give you this drug, didn't really see any benefit. Give you another one, this drug. And so we're putting all of these chemicals in an uncontrolled experiment on that patient. They're not, there's a history, medical exposure history is an important variable in determining whether some future drugs will work, right? So if you have certain chemos, they want to know if you had other previous chemo or previous treatments. And yet this is completely, you can do off-label prescriptions. This is completely unregulated this way, and not to mention the money that goes into the doctor's practice by virtue of all these prescriptions, many of which end up not being used totally. They end up being thrown away,
right,
or dumped into the waste stream in the toilet, in which case the fish end up getting drugged, right? Our water supplies end up with all these drugs in them and these chemicals.
In my 18 months, we had a bucket full of them because I was kind of hesitant to even try that. My own story was I started with a skin rash and didn't realize that was a first red flag for my own health. And being given steroids, I had a 40-pound weight gain. So by the time, 2 kids, I'm about 140, 40 pounds with steroids. I'm at 180, 185. Not knowing what the heck's going on with my body, I started having severe abdominal pain. And it mimicked gallbladder, but my gallbladder was a little below average, but not anything terrible. And 3 months of that pain, I researched. I had a Case Western doctor who recommended my gallbladder be removed. I did that. And I don't remember how many months, several months later, I'm in even more excruciating pain.
Yeah.
And so that process took about another year and a half, whatever it was. And because I was in so much pain, I learned that when I ate, I had deeper pain. And so I quit eating less and down to 102 pounds, desperate to find somebody to help me. I had every scope scan, a CAT scan, an MRI, a colonoscopy, an endoscopy, blood work, parasite testing, all these things.
You swallow the camera.
I swallowed a camera.
Mm-hmm.
And so the functional doctor, ironically enough, that we found was a regular MD who was a Harvard grad, did his residency at the Mayo Clinic, and worked for a well-known hospital. And after 5 or 6 years, whatever it was, decided to leave because he was disgusted by the labeling of everything and the band-aiding through scripts. And he went into functional medicine. And
I think his terminology was, I'm tired of writing prescriptions that do nothing to solve the problem of the person.
Oh, there you go.
Right.
So this sounds like a good guy.
Yeah, he's very good.
Very ethical.
Saved
medical.
life.
He saved my life. Yeah. Because had we not found him, I don't even know that he would have been. Had I not gotten ill, we'd have had the knowledge to know how to help Haleigh, because the body is amazing. It can heal, and and it can recover in so many ways. I'm not saying it's easy or it's quick. It's not.
But a good functional medicine person will describe to you what they think is actually happening and take the time and
Oh,
details.
absolutely. They work with, first of all, they're not influenced by insurance or pharmacy. So,
because it's all out of pocket.
and it's a one-on-one. I mean, our function, in our experience, our functional doctors, you have a one-on-one conversation. It's not, oh, I'm an hour and a half behind. Here's your 15 minutes. See you next month. I mean, that's just night and day experiences,
Mhm.
both for myself and for Haleigh.
And this person practices out of Marysville?
No, they practice out of Westerville. Yeah.
Westerville,
Westerville.
Ohio. Okay, cool. Yeah, so when I wrote the book Cures versus Profits, you guys can see my book collection over here. By the way, if we run out of things to talk about, just pick any book here,
Okay.
and we can start on any page, and we can just start talking. But when I wrote that book, it occurred to me, looking at my own personal experience, but more importantly, talking with other people about their experiences with allopathic medicine, that this diagnosis by treatment is a huge boon to income for pharmaceutical companies. Because as I described, okay, here, take this bottle of pills. Did it work? No. Okay, come back. Throw away 30% of it, 40%, maybe 60% of it, and go to the next one, go to the next one, go to the next one. And I also learned, well, at the University of Pittsburgh, of course, like it's unethical if you're doing diagnostics and pathology to do a whole CT scan on every person every year.
Yeah.
Because there's so many false positives. There's little things that show up in our body. They're not really, the pathophysiology isn't there. It's not going to cause, but it's in a location that mimics something serious.
Right.
And you might have some mild inflammation, but also cancers come and go all the time. Tumors come and go into our bodies. Our immune system kills them on a regular basis. So if you actually found every tumor that ever occurred, you'd have a major, major boon in terms of treatment, right? As opposed to wait and see. So the ethical pathologists that I worked with and that I knew would often take a wait and see procedure. We're going to wait 3 months for the lumps and see what happens. It's scary to the patient to wait, but I think that's part of the reason why they do that. Of course, I have to put the caveat out there. Anything I talk about is research based, and we're talking about medicine, but I don't have any advice for anybody on medicine.
Well, for me, I'm living proof in the sense of I had not only did I have Crohn's and a vast amount of other things, but I had ovarian polyps and uterine fibroid. You call it fibroids.
I think it's fibroids.
And within a year, they were gone. And
That's
this is,
fantastic.
this is under the stress also of living with a child who's been seriously injured.
Yeah, that stress can get to us. So let me throw you a little curveball here. Tell me about Bearcat. What's Bearcat all about?
Oh my goodness, that's the heart and soul of my daughter.
Tell me about Bearcat.
Haleigh, when you do the parent thing, you go and do the college tours, and she wanted to go to UC, University of Cincinnati. She wanted to go there, and I said, okay, we're gonna go. But then, being the parent, I wanted her not to just, it's kind of like the shiny new car.
Yeah.
I wanted her to do her research, and so I took her to 3 or 4, maybe 5 other college campuses, and she would sometimes, after especially maybe the third one, she started getting irritating. Mom, I already know what I want, It's like, let's appease me, let's just do it.
Do it for mom.
Yeah, and we try to make fun out of it too, and so it just didn't matter. And so from the first moment that Haleigh stepped onto that foot of that campus, it was like I saw my daughter become so alive. She was just beamed, like she would tell me how much it felt like home, but I could see it in her. Like I could see it in her eyes, I could see it in her walk, her step. And Haleigh was there just 2.5 years. And the texts that I got, I can't even tell you. The emails, not so much emails, texts and phone calls.
Yeah. So happy there.
She would just
She
say,
found her
Mom, I
niche,
love
right?
it so
Yeah, yeah.
much. She would just say that over and over and over. She would send me pictures. Like she's walking to class, 9 o'clock in the morning. She'd send me a picture of her Mick and Mac, which was her communications building, because she entered college as a sophomore, so she didn't have, most of her classes were in that building. And she would just send me a picture. Mom, isn't it beautiful? Isn't this a beautiful campus? And it wasn't. I mean, she cared a great deal about her academics, so I don't say that, she was there for any other reason than she just enjoyed learning and
Well, she was also there for
all
the
that came with
sports.
it, but not in the wrong reason.
Tell me about the sports she was
She
into
was
then.
there for the
For
sports.
sure.
She when she went to college, she was like, I'm going to go to college and I'm going to experience everything.
Yeah.
So she went to every football game. She went to every home football game, every home basketball game. And the last year she was there as a student, they were renovating Fifth Third Arena with the basketball team. So actually, home games went to University of University of
Somewhere in
Kentucky
Kentucky.
or somewhere in Kentucky, like a half
Across
hour
the
away.
river.
And she went to every home game. Her and her roommate, they would get in a car and they would go to every home game.
Yeah.
And unfortunately, Haleigh never got to see the arena remodeled.
Uh-huh.
The first game was the week she passed.
But yeah, the first home game was the week she passed away. She was actually getting ready to stand in line for the free student tickets, and she never made that.
Oh, wow. So being a Bearcat through and through, I understand the university did something special for
They
Haleigh.
did. The university's been pretty amazing, at least the academic.
Well,
she was highly involved with her professors. I mean, she was that way in high school. She talked to the advisors and her teachers, and she made sure that she knew who her advisor was and to make herself known so that she could use them for the benefit that they provided. And we had lunch with her professors, and they've invited us to come. They've created a perpetual scholarship in her name. She was the president of Lambda Pi Eta, which is a national honorary fraternity, and they create a perpetual award every spring in her name.
Wow.
They've been wonderful. I mean,
she seems like a very special person who made a positive impact on a lot of people around her. She uplifted your spirits. People.
I will tell you, because of where the campus is located, she had a huge heart for the homeless there.
Yeah.
There are a lot of homeless, and I've read some of her journals. I had to stop reading because I couldn't anymore. But she was 20, and she would write in the winter that she was so thankful for her bed because just a block from her apartment, people were cold.
Yeah.
And didn't have a place to lay their head.
Yeah. Beautiful. So when I don't want to pat myself on the back, but I'm kind of the same ilk, right? So Gracie and I were out in California. I have some funny stories. We're out in California at the height of the recession, right?
Oh, wow.
Politics aside, the George W. Bush recession, okay? And I was there actually giving a presentation, a proposal for a brand new economic model for investment. And I have a publication in a fairly well-circulated publication called The Scientist. And my idea was an IP share market where instead of investing in corporations, the people who want to investors could invest in ideas. So you had a marketplace of ideas. Instead of saying, oh, IBM stock or this stock or whatever stock, you see the actual idea and you read about it, the intellectual property. Sounds crazy because you got a patent, you don't want to share your intellectual property. Oh my God, the lawyers are going to go crazy. But in actuality, the idea that I had was that the solutions that one company has are only part solutions, but if you pair them with another solution from another company, you have the whole problem solved, right?
Right.
And so the CEOs and the powers that be within corporations would no longer make the decisions about what projects went forward. The investors would make the decisions on whether an iPhone should actually have a handle on it or something, so that we don't break them. Is that good for sales? No, but it's good for your customer, right? So what does the customer really want? And so they'll buy the ones without the handles or the ones with the handles, whatever. So I don't know if it was intentional, but we were sitting around the table, there was about 20 people, and there was this one guy who sat next to me. He sought me out after reading my article, and he wanted to convince me to not bring it forward because it wouldn't be good for people. It would be everything. And he said something. He kept talking about Flint, Michigan. Can you believe that this company exists in Flint, Michigan? He kept saying Flint, Michigan, like, oh my gosh. But anyway, there's about 20 of us sitting around the table, and they said, okay, for the appetizer we have lobster bisque, and who would like some lobster bisque? And a bunch of people raised their hand or whatever, and we thought, okay, great, we're gonna get a cup or a bowl of lobster bisque, right? They brought out this little tiny cup, like this big, of lobster bisque that had like 2 tablespoons of lobster bisque in it. And the whole production was like, okay, here's your lobster bisque, and here's yours, and here's your, all the way around the table. And we're all looking at each other like, wow, George W. Bush really messed up the economy here. This is awful. So we're sitting there eating, right? But Grace and I went out to a restaurant, and there was a homeless man out there, and I still have the picture of her in that restaurant, where we ordered our meal. This is something I'm sure Haleigh would do. We ordered our meal, and it was the same thing. It was like a Reuben or something. And we ordered a third one because we saw the guy out there. And then when the food came, I brought it out to him. Well, he also didn't have a coat, so I gave him my coat, right? And he's like, oh, now that I don't have to raise money for food, I can make it to the homeless shelter in time and get a bed. So thank you, right? So that sounds like something that Haleigh would probably have done.
Absolutely.
So we got 2 proud parents here, Doug and Rishanne Golden, and we're about to get to the difficult part, so everybody grab your tissues. But this is very serious. I want to know, was it an easy, just natural, okay, it's time for your meningococcal meningitis shot, and it wasn't a big deal, required for school? What was the reason for the shot?
You want me to start?
Yeah, go ahead.
Okay, so first off, there was no requirement at the time that we knew of. It was just well checked before she was leaving for college, and the pediatrician basically said, hey, we recommend this because she's living in close quarters with others, and this will prevent any possible infection. So doing what we do, like every majority of people in society, we trust our doctors. We said, okay, Rishanne happened to take Haleigh to the appointment that particular day. Haleigh received the shot, and that's kind of, no resistance. We just went along with the flow.
Right.
As we had done.
As we have done how many other times.
Right.
Yeah.
And then she went off to college,
Mm-hmm.
and then you heard back from her that things weren't going so well for her.
Well, she ended up having meningitis, we
Right.
think.
We think we got a call a few weeks later. She said she was feeling headaches,
All
her
the
neck
symptoms.
bothered her, a little bit of a fever, not much, but a little bit. And I said, okay, I'll drive down. We'll go to the ER. But
We were concerned about the neck.
We were concerned about the
because
neck
it's so stiff.
because it was so stiff. We went into the ER. From what I remember, it was just like, okay, you might have meningitis, you might not. They wanted to do a lumbar puncture. I said, absolutely not. There's no reason to. I mean, she doesn't have enough of the symptoms to warrant it. I asked the doctor straight out, if this was your daughter, what would you do? And he said, it's probably viral, and just let it run its course because there's nothing we're going to do anyway.
It was a viral meningitis.
Yeah.
But there was never any discussion like, oh, well, did she get the meningococcal vaccine, and
No.
maybe we can do something to help her with that?
No.
So there's no post-vaccination recovery program in allopathy. Is that right? Have you ever heard of anybody saying, okay, this child is having a serious adverse event, this is
No.
what we know how to do?
I never heard of it.
Didn't even know the word adverse event until recently.
Right. So eventually she started developing seizures.
Yep.
And were they mild or severe to begin with?
Grand mal.
First one was a grand mal seizure.
Was there any sign that she was having some difficulties before she had seizures? Any symptoms like
Well,
she was having
we look
difficulty at
back.
night?
Yeah, we look back and there were times where Haleigh thought, she's like, I don't know, I wake up bruised. I feel bruised. I don't know what I'm doing, if I'm hitting myself. And we just thought, oh, you hear kids sleepwalk or dream.
Yeah.
We kind of dismissed it to that. Why would we? We had no clue looking back. I mean, I didn't know eczema was considered an adverse reaction. I didn't know
It's not. That's
asthma
part of the
or
problem. It's
You know,
not.
exactly.
It's not. That's the part of the problem, right? It's
Right.
one of these things that have been observed after vaccines, but no study has shown, right? And so let's talk about that for a minute, if I could. So when we're identifying adverse events due to vaccination, what the medical community is stuck with is massive body of ignorance, massive unanswered questions, because the IOM in the 2000s did a series of studies, and they didn't do a series of studies. They did a massive literature review at the behest of Congress to try to find out the adverse events that we know that are happening. You know, can you assess causality? And so they went through all of them: asthma, all sorts of autoimmunity, autism, and so on. And they came out with reports. And more often than not, they said in the report that the evidence is not available to show conclusively that there's causality, but we also can't rule it out.
Mhm.
And how that got translated, in particular for autism, and that kind of picked up with other adverse events afterwards, is if there's an absence of any science at all, they still say no study has shown, even though no study has been done. And in my view, and the HHS was found guilty of this, or stipulated that yes, they're guilty of this to the ICANN,
Right.
they stopped doing and reporting to Congress assessment of vaccine safety um, from a causality perspective. And I'll get into the nitty gritty, and this is why this is on this Unbreaking Science podcast. Um, First of all, you can't, if you don't have a study done, the answer is I don't know, right?
Right.
Right.
Absolutely.
Okay, so is there a pig virus that will cause all of humanity to die due to organ transplants? I don't know, because we haven't assayed all the pig viruses and seen any mortality. And it's probably not going to be ethical to inject pig viruses into humans to see if it kills them, but we could do something in primates, right? But no, we jump into it and we do organ transplants from other species into humans without knowing about quiescent viruses that might be resident in the pig genome. You got actual pig organ in your heart beating away, and any of those viruses could be, well, they're dormant, but they could become active. So when you don't know something in science, it's really important ethically that you say, I don't know. That's one of the most important lessons for anybody who obtains a PhD. And I remember during my PhD dissertation examination, I was warned by another graduate student that, oh, this guy, his name was Dick Tracy, actually. That was his actual name. Kid you not. He's going to try to corner you. He's going to ask you questions early on that he knows that you don't know. He's going to try to get you to speculate in the middle, and then at the end, he's going to nail you for speculating. And so if you don't know something, it's important that you say, I don't know. And so he said to me, something about an anurine frog or some kind of a frog, a toad out in the Great Basin, something ecological, and he knew that I didn't know the phylogeny, the evolutionary history of frogs and toads, right? But he got me to say something wrong, or I said something wrong about a toad instead of a frog, a label,
Mhm.
right? And he clued in on that, and then I realized where he was going with it because he started asking about what are the phylogenetic relationships among these things, and I said I don't know. And it was a round robin question, and it got back to him again, and he asked the question. I said, I don't. It came back again, and he's asking it. Well, earlier you said you don't know, but I think anybody who's doing what you're doing should know this, and therefore he asked another question, and I said, well, I don't know. The third time around, he asked a very similar question, trying to trip me up, and I said, listen, you've asked this question twice already. Now it's the third time. You've changed the way you've asked it. I've told you I don't know. So for passing the exam, if I have your permission, it seems like you want me to guess. If I have your permission, I'll guess. Otherwise, I'm going to stick with my answer. I don't know. He turned all red in the face and passed me. Had to. He got a plate of cookies at my dissertation presentation. But anyway, saying I don't know is a sign of an ethical scientist. It's not. We should. When you don't know something and you think that you know something and you're wrong, right? This is the Donald Rumsfeld thing. There's the knowns, the unknowns, and the knowns that are unknown, and the unknowns that are unknown. That's actually true.
Right.
There's actually a contingency table of knowledge that way. But for the IOM to say, okay, we don't know if these vaccines cause this, a seizure or whatever, asthma, autoimmunity, autism, and then for one person to do a press conference and to state that they have decided definitively that vaccines don't cause autism. She happened to be the chair, but she misrepresented. And we saw with Stanley Plotkin's testimony in the Matheson case that never made it into the case. It was never entered as evidence, by the way, where he was asked by the lawyer, isn't it also true that if vaccines, if the evidence to show that vaccines don't cause autism is not there, that you can't say that they do cause autism? Isn't it also true that you can't say that they don't? And then he was pressed on the issue 3 or 4 times, and finally, he said, yeah, but I would never tell my patients that. He said, as a physician and as a logician, no, as a scientist and as a logician, yes, you're right, but I would never tell my patients that. We have that recording of him saying that he would deny to his patients the state of knowledge from medicine. As that's very paternalistic. That's very, we know better than you poor, cattle out there, you sheep,
Right.
and we're going to make your medical decisions for you even before I meet you. I've decided what's right for you, even before I know your history of autoimmunity in your family or anything like that. And so this reliance on ignorance is probably what's responsible for so much of the chronic illness in our society, so much of the autoimmunity, perhaps autoimmune type 1 diabetes could be caused by autoimmune that's induced by vaccines. So you're looking at your daughter. Is she writing to you? Is she texting you, calling you, saying I'm not feeling well from school?
Well, we noticed that she started having trouble sleeping. And, we kind of chalked it up to, oh, it's stress from college. And she would say something, something that just feels off.
Did she ever have problems sleeping before?
No.
Okay. And at what
Actually,
point? Go ahead.
we used to joke that if we had Haleigh first, because she
Right.
slept so well, it would never been a question because my older daughter never slept.
I see. Yeah.
So it was kind of like, thinking back now, maybe that was, speculation,
Yeah.
from my point, but was that another sign that we missed?
Yeah. So, well, I don't know if that's a sign. There's differences in kids, right? In their sleep patterns. There's sometimes big differences. And this is, trying to take responsibility again. Maybe you should have known. And I want to ask you not to do that, because if the scientists have to say that they don't know and they're not willing to say they don't know, how in the world are we supposed to know?
Because as a parent, you say that. As a parent, you want to protect your kids.
Absolutely.
And you try to do everything you can, and it's like,
Right.
why didn't I ask that one question or whatever? And going through this whole process, there was never once a time where any physician or any pediatrician or any medical profession ever presented the adverse side of this. We never once said, hey, there's inserts. You should maybe read this. Or here's a piece of paper with all the top potential things to watch out for. I mean,
Okay, so you brought up inserts. That's a good thing you brought up. Let's talk about the Menactra vaccine. Okay, I looked at the product insert, and I looked at the studies, and one of the things that was remarkable to me was that in the study they didn't use, obviously, a saline placebo, an inert placebo. They used another meningococcal vaccine. But if you look at the list of adverse events that are reported in the studies, something like 8% of the teens that took this vaccine ended up with anorexia. 8.3% for Menactra, I think it was. And so if you have a so-called safety study where you're looking at adverse events and you say, well, at least it's as bad as the other meningococcal, right? It's not worse than, so it's as bad as. I looked at the national rate at the time, it was 1.6%. So you see this elevation of anorexia. It's right in front of you. This is the data that was submitted to the FDA. It's carried through in the vaccine insert. A parent looking at that, even with the doctor, is going to say 8%, 8%. Oh, okay, there's no difference. The risk is the same. But if you stop for a minute and you look at it, you go, 8%. That's a huge percentage of people getting anorexia during that same period of time, right? Now, it's granted the huge numbers, like 40 or 50 or 60% of the population report eating disorders sometime in their lifetime. A huge, huge percentage. But 8% during that short window of time during that clinical trial is a huge, huge burden of morbidity. That's called morbidity. You got mortality and morbidity. And that the FDA just went, oh, okay, fair enough. Are we even aware of what we're looking at when we look at these adverse events, right? Suicide risk in girls getting HPV vaccine has a much higher rate than um, than the baseline in the population. Josh Mazer in Maryland has the numbers on that, and yeah, it's higher than it's the same as the rate of the people that the girls that got the AAHS adjuvant as the control, right? It's the same rate. It's just about the same. So is there an issue? No, there's no issue. But you compare it to national baseline, it's much higher. And so we have a problem with the way that the vaccine safety studies, the short-term safety studies are done. Even if they were long-term and they did the same thing, there are other problems, right, where we have only what are called solicited outcomes or as solicited adverse events. These are the ones, if I'm Merck and I'm doing a vaccine safety study, I have a list of adverse events that I will say are due to the vaccine. And there's other ones that I won't recognize as due to the vaccine. Those should be analyzed as well, and the data should speak for themselves 100%. Instead, what happens is they, in the case of the HPV at least, they opened up new medical records and they put the new data, the new adverse events that nobody would ever attribute to the vaccine in these new medical records. The new medical records data were submitted, but it's not clear that they were fully analyzed. The data should speak for itself. So in the case of a parent being able to decipher all that from the when the doctors don't know, there, it's intentional. There's willful ignorance on the part of the medical community to not train doctors to be able to know what a vaccine adverse event is, or be able to know that they don't know what an adverse event is. It's 100%.
Or some of them even know how to properly use theirs.
Yeah. So after the events became medically significant and you sought medical intervention, did the doctor type it up and put it into VAERS?
No.
No.
So talk about that if you could.
So when Haleigh passed, we informed our pediatrician in the process of getting her medical records so we would have it in case there was a need. She asked us to come into her office. She wanted to talk to us about it. We came into her office and basically we told her what happens, and her immediate response is, "It cannot be the vaccine." I mean, that was the first thing she said.
It's a complete denial.
Before I'm sorry or anything, it cannot be the vaccine. And then she said, "I'm sorry," and she tried to make all these every other connection but the vaccine. And to this day, as we understand it, it has not been reported to VAERS.
She said she had no intention. She didn't recognize it as such. She had no intention of reporting it.
Okay, so for people who are new to this topic, VAERS is the Vaccine Adverse Events Reporting System. Mm-hmm. And medical doctors are supposed to, the way that the federal law is written, report medical conditions that happened after the vaccine, even if they individually, professionally don't think that it was due to the vaccine. The problem is that there's no teeth in this law. There's no penalty to them for not reporting. And so, as we know from the Harvard study, the Harvard report on the auto VAERS, this is an automated VAERS system that was designed by Harvard Pilgrim. CDC paid over $1 million to have this system built, and then they unleashed it on the medical records to detect automatically potential adverse events. They found and reported a 100-fold increase in the rates of adverse events, which means medical doctors are not reporting as they should. And that also means that we think vaccines are 100 times safer than they might actually be. And so some state organizations are thinking about creating legislation to have their state do their own vaccine adverse event system and automate it. So that, the public health officials in that state are responsible for public health in that state. And so we could see a slew of legislation proposed this next year to bring auto VAERS on. It's available. The software works. It's already proven to work. I think you can download the software and install it. But So, right, we're got you guys on the screen instead of me. That's okay. I don't mind that. I don't want the other thing to happen. I want you guys to be on the screen when you're talking. But if we're looking at uh, a, a massive amount of ignorance of vaccine injury risk and so on, do you think that that doctor that you said this was not the vaccine? Do you think that she was executing responsibility to tell you that, or do you think that was actually her professional opinion?
Um, I think it was her professional opinion, but also a CYA.
Absolutely.
Yeah, yeah, yeah. I can see that, even though she doesn't have any liability.
Yeah, I don't think she knows that. I don't think doctors are educated well enough to know that the VERA system is there for a reason, and it also they have no liability according to the 1986 Act. As long as the doctor did it in the way it's supposed to be, there's no liability. But my guess is she doesn't understand the law, as I think many physicians don't understand how the law works, and she's looking at it for herself to protect her own practice because she doesn't want that as part of her practice. So she just said, um, basically, um, I'm not going to, I don't believe it's that. I still do my own kids. I still do everybody that comes in. I've never heard of that. I've never once had that ever occur.
But I mean, okay, think about it. If our own government study says that less than 1% of adverse events are reported, and she doesn't recognize an adverse event, and
Right.
she can't honestly say how many of her patients have been injured.
Right. 100%. Right. So I'm just going to shut this off. It's not behaving the way I hoped, but that's okay. Your daughter's beautiful.
Thank you.
Right. So the actual contractee for this was Harvard Pilgrim Health. The government would never say we're only reporting 1%.
Okay.
It's a report to the government. And in fact, when the government heard this, the CDC, and it says in the report, stopped returning the phone calls
Right.
to Harvard Pilgrim Health when they're like, okay, what's going on here? This is a problem. We need to do something. We would live in a completely different world if that adverse event system was brought online. So clearly, they have no incentive whatsoever to truly characterize the rates of adverse event. They have no, I mean, when I say they, I want to be specific about who I'm talking about, the CDC, the medical community, and the doctors that I know of that have come through pediatrics practice. When I ask them what training did you get on vaccines, they basically say vaccines work, vaccines save the world, go vaccinate. That's it. You'll see once there's some mild, mild swelling in the arm, might get a headache, some malaise, some fatigue. Maybe they might say that, but other than Serva being administered wrong, there's no liability, right?
My question, and like I said, I'm learning. It's been a really rough several years, but my question is this: if when I was born, vaccines were different and there were few.
Yeah.
And 20, 30 years later, we quadrupled them. And from when I was born till now, you have 72 doses. And if vaccines are safe and effective and healthy for our children, then why is over half of our population living with chronic illness and disease? It doesn't add up. And if the science doesn't exist, then why is it not permissible to question? Are we concerned about our children and in the generations to follow, or are we concerned about something other than that? Is there an agenda?
Very well put. Very well put. And the agenda, of course, is starts with profit, certainly. It starts with the fact that for-profit organizations are in charge of developing vaccines. That's terribly conflicted with respect to safety. I mean, these are the vaccine manufacturers are the same pharmaceutical companies that are busted for, you know, time and time again for um, felony like
Right.
crimes for other drugs. And I have an interesting story about how vaccines are somehow magical, right? They're absolutely safe. They're just covered in pixie dust, and um, when I had lunch with high school chemistry teacher, my student's high school chemistry teacher, I think ninth grade teacher, um, I had just published Cures versus Profits, and I was excited about it, so I'm telling everybody about it. And I said, I've got this chapter on robotic prostate surgery. I've got this chapter on why markers on breast tumors tell us what chemotherapies might work and what might not. And I just went through all the chapters talking with them about it. And many of the chapters touched on things that pharmaceutical companies have done wrong, like ADHD medicating everybody, and so on. And he said, he agreed with me on every point where we were critical of pharmaceutical companies. He agreed, point after point after point after point. And he said, yeah, my wife was a former pharmacist. She had to quit because of all of this. She didn't want to hurt people, right? And so I'm feeling him out, and I'm like, do I dare go there on the vaccine chapter, right? And I did. And the conversation came to an abrupt end. This wall went up. He's like, I would never do that. I'm talking about William Thompson, the whistleblower that said that, they had the results. They were in hand. I was supposed to go to the Institutes of Medicine and show them these results. They put me on administrative leave. Frank DiStefano took my slides, took the results out. I went to Julie Gerberding and I complained. And I was put on administrative leave for doing that, so Julie Gerberding knew, and now she works for Merck. And he went to the IOM with a incomplete set of results. The official CDC position on that one study, this is the MMR study, on-time MMR study, Frank DiStefano and co-authors in 1984, I think it was that the study was never designed to ask the question about autism increased risks in subgroups, and yet they had negative results. They showed the IOM all the negative results for African American girls, for all those other subgroups they showed them, but they left out these results for African American boys and for isolated autism, the ones that have no seizures and so on. So independent of race, there were two subgroups there that showed increased risk of autism. But no, he wouldn't have it. It was, and I think what it was is he was a parent. When parents who don't have vaccine injured children didn't see it themselves are confronted with this, there's this undertone. They think you're telling them you put your child at risk. Or what are you doing letting your kid play in traffic? What parent is going to respond favorably to that? What are you talking about? I mean, you tell me I'm a bad parent? What are you doing letting your kid, you don't confront parents that way. Your kid is your kid and you know best. Okay, fine. My kid is my kid. Just if they get into a fight, then we talk, right? Something like that.
Right.
But in reality, we're looking at this communicating to the rest of the population. This defensiveness comes on, and of course they're reinforced 1,000 times over by the media and everything. Every news article about autism has to say vaccines don't cause autism. Every news article about vaccines has to say vaccines don't cause autism, right? And so it's totally reinforced by immersion propaganda. Why? Because, well, the powers that be are afraid people will stop vaccinating. But we're not saying every child that's vaccinated will develop autism. We're not saying every child that gets them an after vaccine is going to have the problems that Haleigh had. What we're saying is that there's something unique and special about these individuals that put them at what I call special risk, individual risk, specific risk, I'm sorry. Specific risk is the risk that's attendant to and applies to a subpopulation, whether science knows it or not. Because I like to deal with approximations to truth, right? That's what science is for, is to try to understand things. So for your doctor to say it's not the vaccine, how far into the details of the description did you get before she denied that it was vaccine? Like, you said it was immediate?
Oh, it was immediate.
Yeah, walked into the office and immediately after we sat down in a private room, she said it can't be the vaccine.
Mm-hmm.
Didn't even have to Didn't even have 10 words out of my mouth.
Mm-hmm.
That's incredible. See, that tells me that it was certainly CYA, but it was also
That's exactly.
a programmed response.
Yeah.
Absolutely.
That they have a responsibility to misinform patients on the possibility or the state of knowledge.
And then, you know, we listened to her. We tried to be very respectful, and we listened to her. And then we said, well, listen to what we've learned, because through Haleigh's treatment, we were a parent who was willing to do anything and everything. And so
Yeah.
not only did we have a functional doctor who specialized in neurology, but we also had a Western medicine neurologist who Haleigh despised visiting every 6 months.
Mm-hmm.
Completely different levels of treatment, completely different levels of communication and patient doctor interaction. And so we tried to share with her all the information that we had learned, and she wanted no part of it. And that to me spoke volumes, because I thought, as did when we shared the same kind of information with Haleigh's Western medicine neurologist, I would bring some of her testing and say, okay, well, you have her on this, but this particular thing depletes her body of B6, B12, and folic acid. And he couldn't answer as to why he wouldn't supplement her with that. And I'm like, well, we know that B6, when you're low in B6, there's also just an increased risk of seizures, just having a low B level.
And what do you, or they attribute the low B6 to?
It was what the Western doctor prescribed for her.
Mm-hmm.
She was on a prescription. That prescription removes vitamin B6, B12, and folic acid or folic acid.
Shuts down the pathways.
Yeah,
Mm-hmm.
It doesn't let the body produce it or
Mm-hmm.
absorb it. I don't know the technicality. I just understand how the basics there. And when she was first prescribed this, they also prescribed folate, and his reason was in case she got pregnant.
What?
Yeah,
Yeah.
And I said, you're so concerned about a child that she'll never have, but I'm concerned about the patient. Like, I'm concerned about her.
Yeah.
And then we, as you're learning and you're asking questions, you learn that there's a whole, folic acid versus folate, and how the body.
Take a minute and tell the people who are new to this about that.
Okay, so I don't know that I can get it right, but I mean, some of these books are very difficult to read and learn.
But what do you know?
But
don't worry about getting it right.
So folic acid has to be processed a particular way. And when we give, is it folate? I don't want to get them backwards. When we give folate, the body doesn't use it properly.
Folic acid is the artificial one. So
right. Okay.
So the body has multiple inputs into which we can actually augment the B12 methylfolate.
Right.
It has to be methylated.
Basically.
5,10 methylene tetrahydrofolate reductase.
Exactly.
Right. We won't go there.
Yeah.
Okay. So just because I can, I'm showing off.
So working with the functional neurologist, he said, you don't want her on that. You don't want her on the folic acid. No, because it's harmful to her body. And he had no clue. And I would, here I am, the parent, feeling like I'm, we're going through all this, and I'm having to feel like do my homework to advocate for my daughter. Because, you have to remember, we were still new to this.
Yeah.
But I knew what I knew from my own experience, that functional medicine, which was whole food, clean food, a whole different way of any medicine that we had ever understood.
Yeah.
Taking advantage of the tools and supports that the body needs to heal itself. Knowing what I knew, I kept going back to the neurologist knows what he's talking about. And me, I would like, okay, where can I read about this? Where can I learn about this? Yeah. But taking these tests and these questions to the regular Western neurologist, he wanted nothing to do with it. And
when you say Western, you mean allopathic? Right?
Traditional. He also treated Haleigh. I mean, he was obnoxious the way he treated us, because Haleigh was 18. We would go in the room with her, and he would talk to her only, make eye contact with her only, and
it's a hard time to let go under any circumstances.
Yeah, I mean, like as if she could 18 properly advocate for herself and didn't need our support, and as if he, but then when they came to pay the bill, they were happy to talk to me.
Right. Yeah.
You know, that's a real problem.
Well, we always had a rule when we were in the room, because we would all go together every appointment. So we had more than one version of one way to be heard. The first thing Haleigh would have to say at every appointment is, "My parents are allowed to speak on my behalf,"
Right.
and get that off the table.
So you had HIPAA.
So we had the HIPAA
Right.
taken care of, and the doctor couldn't
And it
leave.
had nothing to do with us like twisting her arm or anything. It was that she's a young girl.
But you were asking
She's
harder
just,
questions.
yeah, she's starting out in life. This
And
is
it-
not something she even wanted to even consider
Yeah,
thinking
but
about.
understand from the doctor's perspective, you could have been a cousin, you could have been a neighbor, it doesn't matter. You're asking the tough questions.
Right.
And, my neighbor just told me that her daughter said, go ahead to the doctor. Don't give him a hard time. I'll just get the second HPV shot. When the mother had more questions, and she was a minor. So, yeah, they go the path of least resistance. They've got 7 minutes in and out, right? They got a well child visit, but you're talking about a young woman now, 18 years old. She's having seizures. She's not sleeping right. Is that right?
She wasn't
Correct.
sleeping well.
And
She also had, testing showed that everything in her body had gone awry.
was she obviously suffering academically?
No.
She was still kicking it.
You don't know my kid.
Academics were everything to her.
Good.
I don't want to say that she didn't suffer, because she had to work, I think, even harder to try to read and learn. And that was something that we struggled with as a family, because in one breath, we wanted her to feel as normal as she could and to tell her no, because we know that, leaving her at school was a very difficult decision. And she basically said to us, "Mom, you can't keep me at home. I'll feel like a caged animal. You got to let me live my life." And so to try to let her do what she felt made her happiest.
Sure.
Because if she's happy, then her body is, is
100%.
not stressed.
100%. No,
So
when you're doing something that's drudgery and you're miserable doing it, and you're also sick, it's different than when you're doing something that puts you in the good mindset. So cognitively, she was having some difficulties, but she compensated by working harder.
She did, but then there were tests. I guess I should be clear too, that when we would be in the office with her functional neurologist, he would do tests, simple things that she wasn't able to do.
Yeah.
And so just because, I would say, people would say to me, "Well, Haleigh looks so healthy," and I'm like, an illusion. You're healthy until you're not, right? Just because you don't see it doesn't mean it's not going on at a cellular level in your body.
Sure.
So even though she may have gotten really good grades, doesn't mean that her body, think about, if it took her, typically 10 hours to study for a test versus now it took her 15 hours. You know what I'm saying?
Yeah. So she compensated by working harder, putting more time in, as Haleigh would.
Right? Absolutely.
That's just how she was. She was just driven that way.
Okay. So when Haleigh really started to crash, and there was nothing, you tried everything. Your entire year was focused on trying to make her better, and you really weren't concerned about, proof that it was the vaccine, whatever. What's wrong with my kid? I want to know that I want to know that my child is going to be okay, 100%, spending all that time, energy, and effort. We already talked about how there was none of the medical community reached out to you and said, "Oh, this looks like a Menactra side effect, and this is what we do to reduce seizures in kids with vaccines." So that's a big gaping hole where, just like with autism, there's been 16 years of no research on how to recover kids from autism after vaccination. Amazon is banning books that talk about recovering kids from autism. At IPAC, we have a faculty member who moved on to, after kind of mastering all the biomarkers, the potential biomarkers for predicting autism. I might have met her at the IPAC Gala in Ohio. Yeah. Heather, she's fantastic. She went off and she got a PhD dissertation proposal approved for evaluating in a clinical study the recovery of kids with autism. So Amazon is banning, right? This is the world we live in while science is progressing in spite of the misinformation denialist agenda propaganda program that we're all so very well aware of now. Um, if if no one reached out to you medically, isn't that medical negligence? I mean, they're not liable, right, for the vaccine injury itself, but failing to identify some way of getting the seizures under control because it was a vaccine, wouldn't that, have you guys thought about negligence at all?
I haven't really thought about negligence. I think it's a lack of education. I think it's people are worried about their pockets and not about the patient.
Mm-hmm.
And
Isn't that negligence?
well, it could be negligence, but my concern at the time was, okay, we're just going to do everything we have to take care of Haleigh, and we'll come back, we'll circle around when she's well to
Right.
to take
After
care
the
of the
fact.
other facts.
I guess for me, I think that once we shared what we've learned with our pediatrician, for me it became negligent. She became negligent because
Yeah.
you were shared something that you, in my opinion, had a duty or responsibility to then ask if there was an ounce of truth
Yeah.
to anything that we shared, and then you're still treating patients. So for me, in my opinion, I think it's, I don't know if you want to use that word, but it's certainly her responsibility.
Yeah, well, this idea has hit, my brain a couple of times in the past, where while they're not liable for vaccine injury if they are not treating a patient, say, for seizures. Say you have an aluminum-based vaccine, and there's no medical standard of care for that. The medical community, if not the individual practitioner, might be being negligent. So, I mean, there's no way to recover autism according to the NIH. There's no way to recover a kid out of autism. And Scott Shoemaker from Ohio, right? His great success story through
Absolutely.
Western allopathic medical supervised chelation, right? Chelation is not a bad word. Chelation is it's a medical procedure,
Mm-hmm.
right? There was a study that they made it into a bad word because there was a study where one kid unfortunately had a serious adverse event, died. But it's not clear why he died, right? So, if we've got metals in our brain and she had the full CDC schedule, how old was she? She was 18. And how many years ago did she pass?
It's November.
This past
10
year.
months.
And you guys are out this already. That's one of the source of strength, that you guys are so strong and, doing the right thing to get the word out. This could be any other condition and the society would be helping you,
See,
right?
because I've shared this before. I've had the fortune. He was home the last 2 summers, and there were a great number of things that she had to do to try to help her body heal. And exercise certainly was one of them. And we would walk, and mornings, almost every morning that that it didn't rain. For the last 2 summers, and we had a lot of conversations that nobody should have at that age because
Right.
of what she was walking through. And because she studied as a journalism and communications major, she wanted her voice, she wanted her story told. And so in my darkest hour, I let myself do what I need to do. And then I just remember everything that she did.
So Haley wanted to launch an education program
Absolutely. I
for
don't know what
kids
that looked like.
her
We
age,
never
but she,
got to that part because, she would say, a typical young person, Mom, let me just graduate and get my job. Let me get my feet planted and then we'll
yeah,
do something. And she
yeah,
talked about writing a book, perhaps. She talked a lot. The one thing that I was sure of was that she wanted kids, and I'm just going to say maybe 8th grade, on to become knowledgeable. And she said, maybe we can, because she painted and drew, she said, maybe I can illustrate the book and you can help me write it, because
nice.
she really wanted others, she didn't know to question. We certainly didn't know to question, but she wanted to make sure that if anything that she walked through, others could learn. She wanted to share that. And so that's kind of the fuel always behind everything for us, for me.
Yeah. So she had a journal that you said that you haven't finished reading,
No.
and that might be something that someone might be interested in publishing at some time, perhaps. As you go on and you get more experience and you get more kind of community connections, if you will. There may be a story there. I mean, Haleigh's story is certainly something that I'm proud to help bring forward. It's sad that we have to, but I'm proud to be part of Haleigh's educational mission.
Thank you.
No, I'm more than happy to do it because it's so important. Um, let's talk about what what's your position now on vaccines? Because there's a lot of people who think that people who don't vaccinate because of what they perceive to be vaccine adverse events that the medical community doesn't recognize as vaccine are somehow anti-vaccine, 100% anti-vaccine, and that some people do that. They're 100%. Some people are against the vaccine that they're concerned about, and some people are, something else. Like I coined the phrase vaccine risk aware a couple of years ago, I think it was. Um, if you don't mind, where you guys stand yourself, if somebody says, well, you're anti-vaccine, are you saying no one should ever get any vaccine ever? I mean,
I'm saying that, in the culture that we're seeming to live in, that it's very concerning to me to hear about legislation being mandated to require vaccines. For me, I'm respectful of other people and their choice. Whatever works, whatever they, see is best for them and their family, I totally respect that. For our family, we would like the same respect. And so based on what we know for us and what we've learned, we can't get there in understanding how injecting such neurotoxic chemicals could be advantageous to the body. And so I don't label myself.
there you go. That's
I'm
an
not about
answer.
a label.
Yeah,
That's a total answer,
I
right?
think more of my position is education,
Right.
Yeah.
truthful, informed consent, or denial. Doesn't matter which way you want to put it. Is you provide me the truth, I can make this decision as an adult or as a parent for my child.
Yeah.
And as long as the information I am receiving shows both sides, the positive and the negative, and I can actually see and it's unbiased, then I make the decision based on what I feel is good for my family.
Yeah.
And we respect that. I'm not going to tell anybody they shouldn't. I'm not going to tell anybody they should.
Right.
All we're going to do is share our story, tell you what happened to us. We'll provide you links, information, whatever you want that we have acquired over this period of time, and you make your decision. I will never shame you for doing it or not doing it.
Right.
We'll support you in any way you want to be supported for it.
Right. That's cool. So you mentioned a few things here. You mentioned informed consent, and informed consent, of course, vaccine choice laws being at the state level,
Right.
but there are federal
Right.
laws that I'm trying to popularize, including some code of federal regulations that require informed consent for inclusion in human subjects trials. And since vaccine safety science proceeds as where there is a randomized clinical trial, it proceeds as a short duration clinical trial with only partial health outcome, and then what they call pharmacovigilance, where they put it out on the market and they try it on millions of people, and then they see what vaccine adverse events might occur, and then they deny all the ones that are occurring, except for the ones that they're willing to admit to, right? So that being the state of science, the Code of Federal Regulations has special protections for pregnant women, special protections for children. It's very hard to get children and pregnant women into a randomized clinical trial if they don't want to be in there, right?
Right.
And so the 21st Century Act came along, and at the last minute they injected a clause that said, well, if the people running the trial, the IRB board, the Institutional Review Board, thinks that there's a minimal risk to the patient for them being enrolled in a clinical trial, that they don't have to be consented. They don't have to be told that they're in a clinical trial. I think that was put in there to try to cover the post-market vaccine safety studies, but it doesn't hold up to logic, right?
Right.
If the purpose of a post-market vaccine safety study is to determine the safety of the vaccine, then how can you fail to provide for informed consent to patients who are unwittingly enrolled in a clinical trial to study safety on the assumption that what you're testing for safety is safe enough that they don't have to get informed consent. So it doesn't really work, logically. It shouldn't hold up legally. Um, if there was a single message that you would like to transmit to patients, parents, young adults, and so on about Haleigh, not about vaccines, but about Haleigh, what's your single message about your daughter?
That her heart was so kind. Like for her age, she was wise beyond her years, as is my other daughter, our other daughter. I mean, it hurt her heart when people weren't kind. I can't tell you. And maybe even some of her friends wouldn't necessarily always see that because she came off very strong.
Yeah.
Like, and some even, like, she would say that she was sassy with a dash of sweet. Like, that's how she would describe herself, because she would always tell us she was funny. And
Yeah.
she would say she knew she was funny, but she did that because it would make us laugh. Because she would be very funny about, like, I know I'm funny, whatever.
Yeah. So tell me
but-
about Haleigh'sHeart.com. What's the purpose of the website, and what are your plans for it?
Well, the website's evolving. We're hopefully going to be partnering with some people that we've met at your event, at the IPAC event recently, and some other friends that we've made along the way. This community's been outstanding. It's been warm and loving and very supportive, non-judgmental. Like you said, I mean, it's been 10 months. So sometimes when I look back and I think what we have done, we held a town talk in April. My focus, I think at the beginning, it was just numbing. It was because we were in shock. And so I'm kind of like Haleigh in the sense of, like, I just want to do to make it feel better.
Take the energy and do something with it.
Yeah. Yeah.
That's
what we
Aikido.
did.
You should look into Aikido. Do you know about Aikido?
I do. Yeah.
Aikido is great for transforming negative energy from any source into something positive elsewhere.
Yeah.
It's a great philosophy.
I think
It's an
past in
education.
November and in January we did a homeless outreach project. In April we did Haleigh's Heart, and then we've been just kind of doing this and that. And
Have you spoken with legislators?
We have. We've met with a couple. We actually have a meeting with the senator a week from Monday.
How have the ones that you've spoken with so far reacted to Haleigh's story?
Most are very empathetic and compassionate. Some can't make the connection because they don't know enough, but we're certainly happy to share information with them and encourage them to do their own homework. Because, a lot of legislators have somebody on the other side making sure they present, their side, and we want to make sure that our children are being represented. When you say you want to be told truth, if that truth means we don't know, then that truth needs to be presented. And so you have one of the frustrating parts as a parent in walking through this is, we didn't know this world existed. Besides grieving the loss of our daughter, we're waking up to a world that we didn't know existed. And so for us, you see, for example, any death is tragic,
right?
But the death of a young person just is really difficult, no matter the cause. And so, for example, you see all these vaping injuries and deaths, and the government is willing to look at that. And you get even mainstream media will talk about it. But my question is, in the world that I'm in and have met, there are so many people just like Haleigh. There are so many families that we've met whose children have been injured, and these parents are caring for seriously disabled and injured children, and some have died, like, how we've had the loss of our child. And so my question is, if this is our truth, why are our stories not worthy of discussing in an open forum? Yeah. Why is it only on in a venue like this? Why can't our voices be heard?
Yeah. So let's talk about that a little bit. When you say a venue like this, I'm a research scientist. maintain my objectivity, which is why I'm talking to you, by looking at the science, finding that the science was completely fraudulent. Can I make up that word? It's fraudulent, right? That's a Gracism, but is completely fraudulent from the perspective of that it's not designed to show causality. It's designed to not test causality. The retrospective correlation studies only, ecological studies, whatever, they only ever show correlation or association. And association is a measure that says, yeah, there's some relationship, but we don't know what that relationship is. It could be an indirect relationship where you have to go through something and it's conditional, or it could be a shared common third factor that's a cause of these two things, right? So um, I can't for the life of me think of a third independent thing that's happening that would cause vaccine rates to go up, the number of vaccines on the schedule to go up, and autism to go up. I can't think of some other thing there, right? So we're kind of missing that. But um, the this forum that you're talking about is kind of unique. I would like to think it's a little bit unique because we're just having a conversation. I'm not reporting.
Right.
I'm not interested in reporting. I'm not a reporter. I'm certainly offering, my opinion, and I'm certainly offering the knowledge that I've obtained by reading thousands of studies and the things that I do and the research that I do. But this is what I call the new media, right? We have the fourth estate, um, which is supposed to be the media. Our Constitution says we should have a independent. That's the word right there. Independent
Right.
media. When the government tells the media, the fourth estate, what to do and what to say, we need the fifth estate. That's what this is.
Yeah.
This is just the conversations. This is people having conversations. This is us exercising our First Amendment rights to talk to each other, to freedom of association. And if they shut down these channels that I've opened up, then that's censorship just for people having a conversation
Right.
and broadcasting it. And sharing it with people who choose to listen. They have the
Right.
you don't like this, don't listen to it. If it's not your game, there's millions of other things that you can listen to.
Sure.
But I have been censored by the government for communicating in a public forum before. Bernadette Pager and I decided to write comments together, join our comments together on a proposal to weaken the MMR vaccine insert because it was too scary for the public. And we submitted our comments online. You upload them, and then 5 or 6 days later, we realized ours hadn't come out, and yet hundreds of others had come out. And we did the math on the number that were submitted and the numbers that were published. There were 75 others that were missing.
Mhm.
And so I contacted Jim Moody. We contacted Jim Moody, and we wrote a letter. And Jim put it on his letterhead and sent it in to the CDC that said, "Hey, CDC, First Amendment." That's basically all it said. It was a very short letter. And 3 days later, and by the way, I want to read what other people have written. What are those missing 75? Well, apparently what I had to say and what Bernadette had to say was so dangerous that the government thought they would censor us in what was advertised as a public comment session. That's required by the law. The way that CDC operates is before they have the change in the vaccine insert information, they have to invite public comment, not private comment, not expertise, just public comment. So Mary Holland's statement was censored and wasn't released. Andrew Wakefield's comment was not released, and there were many others. Well, ours came back to us finally. The first reaction that they got from was to send it back to us and publish it, but ours was actually redacted with black lines through the text. That's a government agent actually taking and saying these words are too dangerous. You can't say those. And so we wrote back to them again and said, okay, we're going to escalate. I think that's how it went. I'm going to have to read my own blog article. It's been a couple of years, but they ended up releasing ours unredacted completely, and then they also released the other 75. So standing up to the government, and telling them what your rights are is certainly something that we're going to be talking about here, and how to do it in a peaceful way, in a tactful way, in a way that's not inflammatory, right? We don't always have to go to the hilt. on these
Right.
issues, right?
Right.
In Ohio, there was a news came to me from the Ohio Advocates for Medical Freedom group that there was a new rule that was coming down from HHS that all of Region 5 preschoolers had to be vaccinated before they went to preschool. And they were concerned because this, in the state of Ohio, they started it. And then they found out later it was all of Region 5. And so they said, Jack, what should we do? Should we sue them? What should we do? I said, just write to, it's a new administration. It was an Obama era carryover on the HHS, somebody who maintained their job. And when Trump came into office, I said, just ask for a policy clarification. And that policy clarification came through, and they said, you're right, the policy is being misinterpreted by this officer, and we are not seeking to enforce this in your state or in any other 5 states in Region 5. And that was a major victory. So sometimes just using the civil tools that are available to us is a wise way to go forward. In California, of course, we have just seen the arrests of a grandmother, a mother, and some other moms for protesting to try to get the message to Governor Newsom that he should veto the second bill and the first bill. He ended up signing it, of course, and so there are definitely times for peaceable protest, for passive resistance. Um, there's also a time for civil disobedience. I'm not a lawyer, so I'm not going to lose my law license. I'm not giving legal advice, but if you want change in society, I think Martin Luther King said that if the law is wrong, then you have a moral obligation not to follow it. Um, People who want to exercise the right to choose, but the legislators see differently in their state, and they want to not allow you to worship freely, then you should continue to worship freely. If you're not allowed to talk, you should continue to talk. Regardless of what our sanctions were to come to me, it would be very difficult to imagine myself ever saying it is too costly for me at this point. I need to stop talking about these issues. And I'm not being heroic. I'm exercising my rights. I'm not trying to be heroic anyway. So people, I know of one dad. I won't say who he is, and I won't say what state he's in. But he has a severely vaccine-injured son who developed autism. He was diagnosed with severe chronic ulcerative colitis and ulcers all the way up and down through the digestive tract. Of course, that allows all the toxins in from food and other things as well, and so you get encephalopathy. Um, Clearly vaccine-induced in terms of the timing, and he said to the state that he was in, the school board started giving him trouble about his daughter coming to school. And he said, no, my daughter will be there on Monday, unvaccinated. Try and stop me.
Mm-hmm.
That's civil disobedience. You're talking to a school board. I'm violating the law right in front of your face. And if you want to make a big stink out of it, go ahead, but we're going to be there. That level of civil disobedience can work in the individual case where, yeah, his daughter's been in school every day since then, unvaccinated, or it can work where the state decides enough is enough, we're going to push back, and, parents get arrested trying to get their kids into school. That would be a vision, right? I'm trying to get my kid into school and you arrested me, all right? That would be a sight, a visual that the rest of the public would have to say, what are we really doing here? All this parent wants is their kid to be educated.
Right.
So, I mean,
and as a parent, like, coming from a little bit of like understanding now, my question to the vaccinated parent is, if your child's protected because they're vaccinated, then what do they have to fear from an unvaccinated child?
Right. Right, and then that goes to their answer to that is the immunocompromised kids. You're putting some hypothetical immunized compromised kid at risk, but those parents also don't know that their vaccinated child, if they get a live inactivated vaccine, can develop an infection where the wild type virus can come in because the vaccine is not an exact match to the wild type or virus or bacteria for the case of pertussis, and that they can actually be spreading through asymptomatic transmission. And when I went to Connecticut and I was educating a panel of legislators there who were considering stripping religious rights away, I said, so it would be good to have some unvaccinated kids in every school. So if there is a transmission chain, the immunocompromised kids can be alerted to the fact that, oh, we have mumps in our school. Oh, we have pertussis. And this man said that he was offended. That was right. So he reached offended that I propose that we put one child at risk by having them unvaccinated to the benefit of another child's health, that we use them as a guinea pig. And everyone in the room recognized right there that that was the logic of vaccination. We're going to put some children's kids' health at risk so the other ones could be protected. And all I said to him in reply was, thank you for your comment. Right. And then he brought up something about, Ebola. He looked at my credentials and I wrote a book on Ebola and I was the founder of the Ebola Rapid Assay Development Consortium. And he said, it's interesting that you've written a book on Ebola. He said, did you know that there are doctors right now that are being attacked by patients in the Democratic Republic of the Congo, I think it was, where there's an Ebola outbreak and there's violence against doctors for trying to, protect people from Ebola. And I said, well, that's why I'm here. That's why I do what I do, because I know, and this wasn't a threat, it was just an observation and a truth. I know moms who in states where they're becoming fearful of forced vaccination are actually buying guns to protect their child because they're so fearful that their child will be injured by a forced vaccination that they're going to go to the hilt. That's not what we want. We need forums like this. We need to educate as many people in the public as possible. Del Bigtree, the entire Highwire team really set the stage. They're doing their thing, and it's fantastic. I've been on it many times, and I totally support what they're doing. There are many podcasts around. I'm hopeful that people will look back at these early days of this podcast later on, and they'll see where we've evolved into a forum for open, rational discussion, debate, discourse, logic, science. And I'm eternally grateful for both of you for sharing everything that you did and are sharing about Haleigh's heart and her the bigness of her personality and the love that she brought into this world for the time that we were lucky enough to have her. Um, I want to talk about California for a little bit because everybody's looking at California, right, and New York about what's going to happen in my state. That's the big right. Don't California my Ohio. I've seen that shirt by I think Ohio Advocates for Medical Freedom or Ohio Health Freedom might have that. But when 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 the state has decided that vaccination is so important that it's okay to hurt a subpopulation of people, they want 100% vaccination, which means 100% vaccine injury. It means 100%. However, whatever percentage of the population can be injured will be injured under 100% vaccination, and 100% of the people that could be killed by a vaccine will be killed. When you contemplate that in your state, what do you think?
I'm mortified. That's why we're active. That's why we're every day trying to learn more, not only for ourselves, but we have another daughter, and I hope to maybe one day have a grandchild, and we can't be silent. We have to bring to attention to legislators to the science that doesn't exist and what does. They have to understand the truth. They have to understand what's at risk, and they can't just blindly, certainly not do what happened in California within hours. I mean,
yeah.
These people are elected to represent their constituents, and looking at what's happening in California, obviously, I don't think they did an accurate job of representing their constituents.
Mm-hmm.
I don't think there was any conversation. I think in California, from what I can understand, it was one individual driving the train. They took his word for it as being God, and this is the way it has to be. And there was no let's sit back, let's take a break, let's let things calm down, let's get some experts involved. I mean,
What was the rush?
yeah, what
I
was the
mean,
rush
you
at
know,
this point? I mean,
Yeah, so what we're talking about is the bills. The first bill in California stripped your religious rights to say no to vaccination and your philosophical rights. And then there was a second bill that came in that said that medical doctors can only give medical exemptions if it follows the CDC's recognized contraindications, which we just talked about. They're not complete by any means.
right.
It strips doctors' rights to practice medicine, to take their patient history into account, to use their best judgment. Uh, and the governor wasn't going to sign it unless it had some riders on
Mhm.
it, or some additional add-ons to it. And the rush, I believe, was the fact that California vaccine risk aware community is becoming pretty well organized, and they would have time to say this doesn't go far enough, right? What they were saying was we want to, okay, Governor, if you're going to sign this, these um, amendments don't go far enough. We need more, uh, and they didn't want the public involved in writing their own legislation because then they could negotiate and change it, chip away, or right take control of it and actually change the bill into something that
Right.
was
So
really
who is writing
rational.
law then? Exactly. Who is
Right.
writing law?
So state after state after state, I don't see a clamor from the public for new legislation for 100% vaccination. It's
Right.
all coming from legislators who are acting on behalf of donors. It's all coming from the medical community. When we had an HPV mandate contemplated here at the county level by the Allegheny County Board of Health, there wasn't an outpouring of public support for this move by Allegheny County. It didn't start from the public saying, "Oh my God, look what happened to me. You know, I need this or we need this." What happened was it was medical doctor after medical doctor came forward. Karen Hacker was the director of the Allegheny County Board of Health, and our own investigations have revealed that some of the people that were testifying on behalf of this legislation were actually her employees.
Mm.
They worked for her. That's a conflict of interest that was not revealed. I handed the Board of Health a conflict of interest that was evident in one of the medical doctors, I think, that came over from Ohio to testify. So the medical community wants 100% vaccination, probably partially out of ignorance, but also partially out of the fact that vaccines are failing. The vaccine failure, especially the MMR, means that there's an age shift distribution of people who are vulnerable to measles now, right? Because back in the 1950s and before the vaccine was widespread and the MMR came online, the infants were immune because their moms had antibodies from natural infection.
Right.
And adults were immune because they had antibodies due to natural infection. All adults were. And so you had this small population of people that developed measles. Well, now that small population has been vaccinated and they've grown up and their immunity has worn off.
Right.
That's primary vaccine failure, right? So secondary vaccine failure is that the vaccine itself, I think I have this right. There's primary, secondary, tertiary vaccine failure. The secondary vaccine failure is where the vaccine itself is actually not work. Primary vaccine failure, sorry, is where the vaccine just didn't work in a person. You vaccinate them and it's not going to be effective to them. The medical community's answer is vaccinate and revaccinate and revaccinate and revaccinate. It's 20 times if you have to, right? With no
Right.
studies showing that 20
Right.
mmRs is safe, right? And so the point is that you end up with the revelation that the vaccine does not confer lifetime immunity, that these people were stripped of lifetime immunity from measles and now they need boosters. So there's this kind of a natural evolution of a vaccine where you introduce the vaccine to the market and it's doing very well and it's conferring protection to the targeted population. The population is dynamic and grows up, right? It ages, and so then we end up with people who are immune, who are in their 50s and 60s. The baby boomers are all susceptible to measles vaccine, to measles. But if we had legislation that allows 100% vaccination, as I understand it, and stripping your rights away to say no, then we wouldn't know that measles is around because the storyline goes is that, well, it might not confer immunity anymore, but it reduces the symptoms. so you don't get a frank measles infection, or we can attribute all the measles infections to vaccines. If you vaccinate the adults and everything, well, it's just a vaccine rash. It's not really the measles, right? We can show that because this person has the virus from the vaccine in there. We can show that with PCR. Well, of course they do. They were vaccinated, right? So you're going to attribute the rash to that. So there's all this gamesmanship, and that's not a rational way to design public health policy. The vaccine has aged because of mutations that happen every week. So when they brought the vaccine online in the 1960s, the minute that they separated the vaccine type from the wild type, those two lineages of virus started evolving away from each other.
Right.
And I've done the math, and there's something like 6 vaccines that, on the basis of the published mutation rates for these viruses, they probably have aged out. Their shelf life is over. But then that would mean loss of contract. So we're dealing then, if their concern is that they don't want to lose a contract, because like the whistleblowers came out and said, 2 whistleblowers came out and said in Pennsylvania, yeah, we had to put rabbit antibodies into the vaccine, samples to make sure that the FDA thought that we was 96% effective, not whatever 18% effective, whatever it was. They're doing it to maintain the contract. That's fraud. And if we have government officials that are involved in accepting that data in spite of the evidence that's come forward or something, if there's complicity of FDA officials working with Merck to try to maintain that contract out of this conspiracy of good that I talk about, that people are doing it because they think it's the right thing to do,
Right.
but they don't know the full backstory. Then then the revolving door between the CDC and corporations, and the revolving door between FDA and corporations is fine to talk about with any other drug, but if you put it in the context of vaccines, well, they wouldn't do that. That's what I call fascism. We're dealing with legislation that's written by corporations and put directly into the hands of the legislators and put into law, where the corporations are literally writing the law.
Absolutely.
That's absolute fascism if they're donating to those legislators. And so, we need a political change, a sea change in the United States, where people understand that money from corporations is toxic to the democratic process. It doesn't matter what we're talking about. We're talking about climate change. We can talk about renewable energy. We can talk about medicine. He's taken over. We can talk about any topic. I think money from any corporation for legislation is so toxic, because it's not the people that want 100% maximize vaccine injury and death. Nobody, I think, in America wants to say, okay, it's okay that your child suffered so that my child has protection. They don't want to say it, but that's what they're doing. By saying I need to mandate, if you're behind 100% vaccination, then you're saying that your child's life, somebody else's child's life, is worth less
They're
than your
accepting
own.
collateral damage.
Exactly.
And
So, and it's Haleigh is one of untold thousands, tens of thousands, maybe hundreds of thousands of people who have died from vaccines that we will never know. In her case, we might get a ruling. I understand you're considering applying a filing. But if we don't change the way that we conduct ourselves, and by me I mean all of medicine, all of pediatrics, conduct ourselves, then those hundreds of thousands of American citizens and millions of vaccine-injured American citizens are going to rise up in one way or the other. And my hope is that this forum will help reinforce the idea that we need to do this in a very peaceful way. We need to do this in a respectful way and raise the bar and hold them. It's our responsibility to hold legislators to a standard. It's our responsibility to hold doctors to a standard. Just because they wear a stethoscope and a white coat doesn't mean that they're endowed with infallibility by any means. And the pharmaceutical companies' popularity has plummeted. They are the least trusted industry in the United States, and they've earned that position. So we got a few minutes left here. I'm going to give you guys a chance to close out. I asked you before, what can people do? I want to know what people can do to help get Haleigh's message out. I have her card up here. if you can see that. And I have you little cards. What can people do to help you guys get Haleigh's message out?
But we're working, to expand her website. We're starting the process of finding out what's involved to create a foundation so we can do more things. Like I said, every day is still very difficult, and we still have a living to make and jobs and lives to lead. So
Yeah.
we're trying to use every spare moment we can to help spread her message. Visit her website. There's so many links that we put on there as resources. We're not doctors. We're just trying to share information that we've gathered. We would encourage people to not be closed-minded. We would say, think about the things that we're sharing. Think about, why is it that the U.S. has the highest death rate? Like, why do we have
The first day of birth,
on the
right?
first day of birth? Why do now statistics show that young girls have infertility? The infertility rates are huge. Why is that? Why is it that over half of our kids have some kind of disease or chronic illness? Why is pediatric cancer huge in an age group where they're highly vaccinated? What is that about?
So all of these are science questions.
Absolutely.
So you want more science.
I want more science.
So the people who have suffered the most by the lack of absence of science are calling for more science. That's beautiful.
Right.
You're not anti-science. That's part of the reason why I'm doing this as well, so people can understand that there's nothing anti-science about calling for more science. It's actually the opposite. The people that have called to the end of science, no more vaccine safety science, are anti-science. So I tagged you both in a Facebook post about the Menactra vaccine insert. Did you see that?
We saw that this morning on the way.
Okay, so the wording there actually says, I think it was that let me see if I can pull that up, that the wording in the vaccine insert was about attributing causality to an adverse event. I think it was, let me see, I've got it right here.
And one of the things I did want to mention about this particular vaccine, and I knew this was a conversation, so I didn't want to come with notes or statistics, but I know during our town talk, someone shared the actual numbers, the actual statistics regarding that vaccine, and literally, and like I said, I'm just going to paraphrase here, but the chance of having an adverse event, serious, was like tremendously higher than actually contracting meningitis. And to not be told that from my pediatrician is quite disturbing.
Okay, so just out of due diligence, what I want to do is comment on that. And again, we don't have any particular start or stop time, so we can do that. All right, so in the current highly vaccinated population, of course, is going to be a lot less meningitis, right? But were they talking about the meningitis rate before the vaccine? Because I don't know if you guys have actually read up on the evolution of the meningitis vaccine. It's fascinating. It started in the early 1900s, and people got terribly, terribly sick from it, right? And so they tried polysaccharide vaccination, and that worked in animals, but it didn't work in humans. So they came up with a polysaccharide conjugate where they added a protein to the polysaccharide, and that seemed to work in humans. And so there's this effort to try to vaccinate against meningitis. Meningitis, we should say out of due diligence that meningitis does kill some people. Absolutely. And you're not trading off. You're not saying nobody should get the vaccine. So the actual rates in a vaccinated population is saying the rates of diagnosed meningitis are much lower, or the rates of deaths from meningitis are much lower. We have to do that in an unvaccinated population. So it'd be interesting, and I will look into the rates of deaths before the vaccine came on the market. That's important. Even the statistics you cited may be perfectly that. I just want to be sure that we're not misleading anybody. So let's go to this wording here. I said the problem with post-marketing surveillance studies from the Menactra vaccine insert itself, quote, because these events were reported voluntarily from a population of uncertain size, it is not possible to reliably estimate their frequency or establish a causal relationship to vaccination. Let's not worry about what they were talking about. in terms of the adverse event. But my phone is not. Okay, there we go. I said that we need to petition FDA to change the required wording here to, quote, because these events were reported voluntarily from a population of uncertain size, and that means VAERS, it is not possible to reliably estimate their frequency or establish a causal relationship with vaccination. Causality of adverse events also cannot be ruled out using such data.
Right.
That small change of wording would educate every doctor that bothered to look at the vaccine insert that this is not a permission slip, that nothing's going wrong here. This actually would require a new rule from the FDA. We can issue a rule overnight. If there is a massive groundswell of petition among the vaccine risk aware, for everybody to petition the FDA, to petition your congressman, petition your senator, this is not legislation, this is a ruling, a new rule from the FDA. They could classify vaccines as new drugs, and they would all have to be start from scratch with randomized adverse events or randomized clinical trials. Doug and Rishanne, what I want to say is, what if that took on a Haleigh identity, and that was part of what came out of the fact that you guys had no medical doctor that could establish or not establish causality because of this massive groundswell of ignorance? Would that be something that you think would be consistent with Haleigh's?
Absolutely. I think it's about Haleigh's heart. What Haleigh's heart website is about education. It's about don't be silent, because Haleigh was a communications major and a journalism major. You have a right to question. You have a right to ask about something. You have a right to the First Amendment right to ask a question and speak and not be censored within the scope of whatever the law is. Non-instant riot or whatever, however all that works.
Yeah.
My point is, if you don't ask, you're never going to know. And ignorance is not an excuse. And we learned that the hard way with my daughter's life, our daughter's life.
Yeah.
So now is the time for people to say, okay, we've seen changes in society. We don't know what they are, but we want to know why they're happening. We want to know what is going on. We want to know how to get involved, because if you don't speak up when you need to be spoken up for, someone's not going to speak up for you. So now's the time to get involved, do it the right way, be understanding to people that not everybody's going to know and have the same knowledge that you might have. But your job is to present fair, honest information, educate the next person, and then you build an army. And once you have an army of people that are all looking the same way, the government cannot turn make a silent ear to that. They're going to have to react, and they're going to have to listen, and they're going to have to do things.
And even if the army is to say, we have a right to know what the science is. You can't deem something safe and effective for all and mandate it without proof, without truth. And so when you say army, it doesn't necessarily have the negative connotation. It's just standing up for your rights. I mean,
if someone told us that there was a chance Haleigh could die from having an injection, as a parent, I would have said no.
we would have certainly researched. We never even, like, the thought of death.
Let's take death off the table. I don't mean to interrupt.
Kind of an injury.
But yeah, let's talk. What if the doctor looked you square in the eye and said, you know what, your daughter has an 8% chance of anorexia from the Menactor vaccine?
Would have been no.
It would have been no.
And you don't even know the national rates, right?
Yeah,
it's just,
I have no clue. Because
but now you know the national rates are 1.6. So the relative risk is 8.3% divided by 1.6, right? So that's the fold increase.
See, for us, risk means pause and go learn. For us, that's how we are. Pause and go learn, because nothing. I mean, outside of like a life-threatening illness, nothing needs immediate. That's our thing.
That's called reason, and that's called using logic and experience-based learning. All science begins with observation. Every bit of science that was ever done is based on observation of one way or the other, right? You can't model. You can't just do math without any observation. You can't assess risk without counting. This starts with one. Okay, so we know that the vaccine adverse event rates are thrown out there. Serious adverse events only occur at, well, 1 in a million. 8.3% anorexia is not 1 in a million.
Right.
8.3% is 8.3%. Okay, there's a problem with this vaccine. There's a serious problem with this vaccine, and it's not just Haleigh's uh, experience with it. What I want to do is on the closeout, I want to say, obviously, thank you, Doug and Rishanne. You're lovely people. I'd like to call you my friends.
You are.
You are my friend.
Thank
Okay,
you.
right? I look forward to working with you. What in the future on many different initiatives. What I'd like to do is I'd like to encourage everyone who's seeing this to go to Haleigh'sHeart.com, right? And whenever you see Doug or Rishanne at an event, grab these cards and spread them around. I've been leaving them in restaurants as Grace and I go out to eat.
Yeah.
And as I travel around the country, we have to eat out, right? We're not going to bring a stove and cook, but I leave them in restaurants near the register. Just a kind and gentle reminder that there's more information out there than people know. Um, it is truly an honor that you came forward through this venue. It's an honor to WWDNYK. It's an honor to me. And I know that you're going to be spreading this truth and forward in many different venues. If there's any way in the future that I can be of any help in any way, just let me know. I'm more than happy to help you understand and state what the science actually says so that you're not left out there in the cold. And so, in closing, it's been a great conversation. It's been over 2 hours now.
It's hard to believe.
It's hard to believe.
Went fast, right? What I want to say is unbreakingscience.com is where you can go to listen to the rest of the podcast, the initial boot camp, and find me on Patreon. It's just James Lyons Weiler at Patreon. A small monthly donation will help me pay for the equipment and help me pay for the time and so on that we need for this. This is a technologically advanced podcast. We have the best possible equipment. We have the best possible software, and those things did cost money. So what I want to do is take our time, take your time to go to patreon.com, even if you already donate to IPAC, because WWDNYK is independent of IPAC, and help us have more guests in and help us get more stories out, help us talk about science in a rational, calm way. Those people who are being arrested, I would encourage someone to put up a GoFundMe for their legal costs. They shouldn't have to spend a single dime of their own money in their own defense. That I'm calling on everybody to donate to that first before you donate to this Patreon. I don't even know if that exists, but it really should. In the future, we'll be talking with people from all walks of life in the vaccine risk aware community, and also other people in the psychotropic drug. We'll be talking community, people who, there's a new study out, I think, on the better efficacy of lavender for treating anxiety or something like that. Makes a lot of sense. Lavender kind of chills you out. But we want this to be your podcast that you feel at home at, and it's not scheduled at the same time every week. I might do 3 a week. I might do none a week. What we want to do is bring forward the science with the state of the science, and share what we know. If there are people that can make it to Pittsburgh who want to be on this, contact me through Facebook or email if you want to sit down for a couple hours and talk. If there are people who want to do a podcast from this location, this is the WWDNYK studios. We can schedule you once a month. We can schedule you once a week. We'll talk about that, make that happen to get your word out. I'm Dr. James Lyons Weiler. You can find me at jameslyonsweiler.com. You can also find me at ipaknowledge.org. That's the place to donate if you want to push forward science. Doug and Rishanne, I want everybody to see you one last time and say, hey, thank you so much.
Thank you for having us.
so much. Thank you.
All right. So now I'm like on the high wire here. I got to figure out how to back off slowly from the streaming. Thank you, everyone.